My name is Aaron Taylor.
My name is Jill Beamer.
I'm Tyler Cowan.
Here are our 3 ideas. The first one is a book holder stand. How it works out first is you start off with an either free balanced wheel base, or it starts with a clamp on a desk. So there's 2 different options here that we can go with. Then we have the counterbalanced arm that's attached to that. From there, on the other end of the counterbalanced arm is a specially designed book holder or laptop or tablet holder. So it clamps the book, the holder or the platform clamps the book down by the cover, and then it has another set of clamps that hold the page down, so you can flip the page one way or another easily. The design allows you to look at any angle without having neck pain. I'll get to that later. The idea-patent relationship is the counterbalanced arm that we've discussed in class. And here's our problem, is that many people who read for a long period of time or use their iPad, it's called iPad neck. And it shows here in this picture up to 60 pounds. If you have your head down 60 degrees, you're putting 60 pounds of pressure on your spine, causing neck pain and back pain. This is a prevalent problem for those that use their devices for long periods of time. So the idea uniqueness is, because this isn't the only product that's out there, is the total free range movement of the product. You can use your, you can read your book while laying in bed. So this might be something for people in hospitals, and you can hold it up. It's just complete free range. That's the added benefit. Target market, ages 15 and up. It could be younger. Be as old as possible. Readers, tablet users, office workers, we mentioned hospitals, and religious leaders for those that spend a lot of time in their text study. And here is Tyler with his idea.
My idea is a mechanical butcher. It's using a robot with counterbalancing arms. The robot with counterbalancing arms and its patents that we discussed in class is rapid setup, partially prepared slice, a probe manipulator. It could be as small or as large as you want it to be. My idea and how it works, I believe that with the use of a modern technology, this robot will make processing meat a much smoother and less strenuous process. Therefore, it will solve a huge problem pain in the marketplace. There are many machines out there that can already tell the difference between the hardness, density, and pressure of an object. A safety saw and a torque wrench are 2 of the examples of machinery that already have some of the technology that I would use to combine and to create in this process. Right here is the problem that I'm trying to eliminate. You got this factory line going down through there. These people are making cuts on this meat. And if you use the same hand motion repeatedly, it causes hand cramps and pain and causes a lot of medical issues. The technology is already there to make this. The key to creating this process is going to be merging technologies from the safety saw, the torque wrench, the density scanner, as well as pressure scanners and regulators. Imagine you put all of these objects together. This would be what would give you the robot that could cut the meat. How I know my product will sell, there is nothing else like my product on the market. I know this because one of the largest meat packing firms is currently spending tons of money on research and development of this product. That's the website that tells you about the meat packing industry that is spending money on the problem. So this would relieve a huge problem in pain, save companies thousands of dollars by reducing manual labor, employee turnover, and insurance costs. This will also not require any major change to the status quo.
My idea is an assisted lift. What the idea is a machine that would help nurses lift a patient that has fallen or needs to be transported, but the nurses may be too small or unable to lift this patient. where nurses would slide I found technology of this SCED, they use it in rescue missions and in the military. You slide it under a patient, and I would use the counterbalance arm robot to hook to that so the patient wouldn't wiggle or anything, and they would be able to safely place them back on the bed or wherever they need to go. The patent that I used was the robot with counterbalance arms. The counterbalance technology would be able to use patients to keep patients steady so the nurses wouldn't have to worry about them falling again. The problem pain is, according to the Bureau of Labor Statistics, each year over 35,000 nurses experience back injuries that are serious enough to keep them from working because they're trying to lift patients that they shouldn't be lifting. And the idea is to meet there are other products on the market that could help nurses lift, but with the use of the SCED, it's portable, you can roll it up, it's not like it's going to take up a bunch of room in a hospital room. And the market that I would sell this product to is hospitals everywhere and maybe hospice facilities.
Those are three ideas.
All right.